What's coming up is drchrono. A lot of companies don't get the mobile space, but I think that you'll see with these guys, this is another company that really gets mobile, and I gladly hand it over to them.
Well, very nice, beautiful interface. Daniel, are you ready? So drchrono first came here as a practice management online software as a service practice management company in 2009, and by 2010, when the iPad came out, I think you guys were, you say you were, the first with an EMR application on the iPad, and let's show the latest update of that.
Sure. Hi, everybody. I'm Daniel, co-founder of drchrono. So I'm just going to give you a quick high level. So me and my co-founder, Michael, started the company 3 years ago. And what really drove us to start drchrono was Michael's father. His father was very ill. And he was in and out of hospitals in New York City. And the patient-doctor interaction was really bad. So me and Michael got together, and we wanted to focus on the patient-doctor interaction. So what we call our platform is a patient care platform. And we really took a different approach to healthcare. We focused on a freemium model, so a lot of our users are on the free platform and a lot of the users are on the paid platform. This really allowed us to scale to over 10,000 signups in 9 months. So I'm going to go into the demo. We have physicians, patients, and staff all using the platform. Okay, so I'm going to jump into so essentially right here is the doctor experience. So this is the point of care tool for the doctor. So he sees all of his patients coming in for the day. You can see that right there. I'm going to jump around so you could hop between patient profiles. I'm going to jump into Michelle Harris's profile. Say I'm the physician and Michelle had come into the office. So I dive into her patient chart, and really there's a lot of interactivity that you can do on the iPad, which is really fun. We're trying to make it fun for the doctor. So here's all of her history right here. You can kind of see it. I'm scrolling through it. Right here I see a CT scan. So I'm going to click on the CT scan. And this is really a video, so you can be really interactive with video. One pretty cool thing is we built this technology called Free Draw. Let me show you guys what Free Draw is. I'm going to click on Free Draw right now. And really with Free Draw, you can essentially draw on images, videos, or anything and make it really interactive with the patient. So you could show it to them right there and talk to the patient. It's very engaging. So that's Free Draw. Another thing that you can do on the iPad, which is pretty cool, let me hop back into our patient chart. So all of these forms on the iPad that we built are customizable to the physician. So we have 3 sections: history and physical, SOAP note, and we have a customized section. So we really wanted the physician to build out their own forms. So it's a very quick input, so they don't have to type too much. We really want them to just kind of engage with the patient as much as possible. So I'm just flipping through a bunch of forms here. I'm going to hop around for a second. I'm going to go into one of the customized forms that a physician had created. So it's really engaging, and they can kind of give input very quickly. Oops, kind of going here. So I'm going to, one cool thing is a physician can upload any type of document they want and free draw on it, which is really cool. So I'm going to click on this one. This is one that I uploaded for this demo. It's a lung, so it's really engaging. And one thing that the physician can do is embed these onto the clinical note. So I'm going to click the embed on clinical note right here. And that embeds it directly onto the clinical note. So really fast input onto this thing. So you can see here that there's customizable sections right here. The physician can actually customize the keyboard. So you can click patient name, you can click date. You can even do medical speech to text. So I'll just do one last thing, medical speech to text. Chief complaint, patient has runny nose. See how good it does it. So it did it pretty good, and you can see how engaging that is. There's a lot more to this. This is just a high level for you guys. Thank you.
Daniel, come grab a seat here. Come grab a seat here. So give me a second while Ed's prepping. So let's, if you're prepped, you can grab a seat too. But let me talk to both you guys, and then I want to drag you, Pierce and Tina, into this one quickly. So sound bites. Rick, you've been doing this for a hell of a long time. Sorry, you've been doing this for some time. Give me a sense about the change, just the form factor the iPad and tablets is creating. What your sense of the possibilities are here?
I'm a complete advocate that this will change how we practice medicine, both for us and for the patients, because it now gives us a common tool we could share. But this is the form factor that Steve Jobs developed, even better than the other tablets, I hate to say, that we've been waiting for so long in healthcare. It really is something you can use as a physician in practice, and it gives you a mobile ability to get data anywhere and to interact with it anywhere.
So, I mean, I think you showed a beautiful way of just quickly selecting, interacting. It's just like playing any other iPad app. What are the limits of doing that for? So we talk a lot about big iron and complex EMRs, there've been usability issues. What are the limits of that for what you've built now? I mean, there are things you can't do on this that you need the big iron for?
I question that. Basically, if you look at Airstrip, which GE has a partnership with, who many of you have seen, you can do ICU monitoring. We can do critical care monitoring in the ER away from the bedside. If you look at the quality of these monitors, particularly with a retina display, the FDA has already approved reading x-rays or nuclear scans and such on these devices. I don't see a limitation. Screen size is finally big enough, but not too big that we can't carry it, but it's enough for us to do what we need to do.
All right, and Daniel, you guys, you're part of the Y Combinator program. You guys have an investment from the most famous Russian VC investor, Yuri Milner. What is just for your business planning, what's your assumption about the number of doctors who are going to be using iPads?
Extremely high. I mean, Apple has been on their game for a long time now. The reason why we really built on the iPad is because me and Michael both had iPhones, and we just saw how easy it was to use. And anything that's easy to use, we want to build on. I mean, it's a really simple premise. I think that every healthcare company in the room should have that premise. Build on stuff that just works for you.
So how many of the beacons are introducing, looking at new, he actually hasn't, he's mic'd up already. So using iPad-based tools. Any? Some?
iPad-based tools. Yeah, I mean more than one. But they, I definitely think usability is really important here, both for the clinician and even more for not so much the companies we have here, but these consumer-facing tools that are actually making care more consumer-centered and making it engaging the patients in new ways. And the beacons are trying to reach
to hold
into
your feet
those.
to the fire on the sort of as they come down to spend the money. Is it going to be on stuff like this, or is it going to be on more traditional?
Well, that's why we had the innovation exchange on Sunday.
So after Sunday, it's going to be on stuff like this.